As we get older, our bodies experience changes that can be unexpected and tough to handle. One common and challenging change is a decline in balance. Most people don't think much about their balance until they lose it. But why does this happen? Did you know that persistent balance issues could be linked to certain medications you are currently taking? It's a bit ironic that the very things meant to help us can actually increase our risk of falling over. It's what many common drugs do. In today's video, we will share with you 10 medications that can cause loss of balance. Stick around until the end, as number 6 is one of the most common medications that not many people are aware of. How many other people are unknowingly putting themselves at risk because of their medications? It turns out quite a lot. There are dozens of drugs that can cause balance problems, but some are much more common than others. Do you or someone you know have trouble with balance? What part of the world are you from? After you've watched the video, drop a comment below so we can get to know each other better. Here are 10 medications that are particularly likely to make you unsteady. 1. Blood pressure medications. This is probably the biggest category. Almost any drug that lowers your blood pressure can potentially cause dizziness. The logic is pretty straightforward. If your blood pressure drops too low, especially when you stand up quickly, not enough blood reaches your brain. Result? You feel dizzy or lightheaded. The most common culprits in this category are diuretics or water pills, ACE inhibitors, and beta blockers. These are all extremely common medications. Millions of people take them every day, and for most, the benefits far outweigh the risks. That doesn't mean the risks aren't real. If you're on blood pressure medication and you start feeling dizzy, especially when you stand up, tell your doctor. They might need to adjust your dose or switch you to a different drug. Before we continue, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. 2. Antidepressants. Depression itself can cause balance problems, but so can the drugs used to treat it. This is especially true of a class of antidepressants called SSRIs, or selective serotonin reuptake inhibitors. Drugs like Prozac, Zoloft, and Paxil fall into this category. The exact mechanism isn't fully understood, but it seems to involve changes in how the brain processes sensory information. Some people describe it as feeling like they're walking on a boat. Again, for many people, the benefits of these drugs far outweigh the risks. Depression is a serious illness, and SSRIs have helped millions of people. But if you're taking an antidepressant and you start feeling off balance, it's worth discussing with your doctor. 3. Anti-anxiety medications. Benzodiazepines like Xanax and Ativan are commonly prescribed for anxiety. They work by depressing the central nervous system. This can be great for calming anxiety, but it can also affect your balance and coordination. These drugs are particularly risky for older adults. One study found that older adults taking benzodiazepines were 44% more likely to experience a fall resulting in injury. The risk is highest when you first start taking these medications, or if you increase your dose. So if your doctor prescribes a benzodiazepine, be extra careful in the first few weeks. 4. Sleep aids. This category includes both prescription sleep medications and over-the-counter sleep aids. Many of these work in ways similar to anti-anxiety medications. They depress the central nervous system, which can affect balance and coordination. The risk isn't just while you're asleep. These drugs can cause grogginess and impaired balance even after you wake up. This is why the FDA requires some sleep medications to carry warnings about next-day impairment. If you're having trouble sleeping, it's worth trying non-drug approaches first. Things like improving sleep hygiene, cognitive behavioral therapy for insomnia, and relaxation techniques can be very effective. 5. Antihistamines. Here's a surprise for many people. Those allergy pills you buy at the drugstore can affect your balance. This is especially true of older antihistamines like Benadryl. These drugs work by blocking histamine, which is involved in your body's immune response. But histamine also plays a role in regulating wakefulness. When you block it, you can become drowsy, and drowsiness can lead to impaired balance. Newer antihistamines like Claritin and Zyrtec are less likely to cause these problems. But they can still affect some people. If you need to take an antihistamine regularly, it's worth discussing with your doctor which one might be best for you. 6. Pain medications. This category includes both over-the-counter pain relievers and prescription opioids. The mechanism varies depending on the specific drug, but many pain medications can cause dizziness or affect coordination. Opioids are particularly risky. They work by binding to opioid receptors in the brain, which can affect balance and coordination. They can also cause drowsiness and impair judgment, further increasing the risk of falls. Even common pain relievers like ibuprofen and naproxen can potentially cause dizziness in some people. It's less common, but it can happen. 7. Diabetes medications. If you have diabetes, you're already at higher risk for balance problems due to potential nerve damage. But some diabetes medications can increase this risk further. Insulin and other drugs that lower blood sugar can sometimes cause it to drop too low. This condition, called hypoglycemia, can cause dizziness, confusion, and loss of balance. The risk is highest with insulin and a class of drugs called sulfonylureas. If you're taking these medications, it's important to monitor your blood sugar carefully and know the signs of low blood sugar. 8. Heart medications. We've already talked about blood pressure medications, but other heart drugs can affect balance too. Digoxin, used to treat heart failure and irregular heartbeats, can cause dizziness and vision changes. Antiarrhythmic drugs, used to treat irregular heartbeats, can also cause balance problems. This is partly due to their effects on the heart, but some of these drugs can also affect the inner ear, which is crucial for balance. 9. Parkinson's medications. This one might seem counterintuitive. Parkinson's disease itself causes balance problems, so you'd think the medications would help, and they do overall. But they can also have side effects that include dizziness and impaired balance. The most common Parkinson's drugs, like levodopa, work by increasing dopamine in the brain. This can sometimes lead to a drop in blood pressure when standing up, causing dizziness. 10. Antibiotics. Most people don't associate antibiotics with balance problems, but certain types, particularly a class called aminoglycosides, can damage the inner ear. This can lead to permanent balance problems and hearing loss. These antibiotics are usually only used for serious infections when other antibiotics won't work. But if you're prescribed one, it's important to be aware of this potential side effect. Now, you might be thinking, great, so I should just stop taking all my medications. Absolutely not. For most people, The benefits of these drugs far outweigh the risks. The point isn't to scare you off your meds, but to make you aware of potential side effects so you can discuss them with your doctor. If you're taking any of these medications and you start feeling dizzy or unsteady, don't just ignore it. Talk to your doctor. They might be able to adjust your dose, switch you to a different medication, or suggest ways to manage the side effects. There are also things you can do to reduce your risk of falls, regardless of what medications you're taking. Exercise regularly and have a balanced diet. On our Instagram, we have a post about 3 worst and dangerous foods for balance and dizziness problems, so make sure you check that out too. Be sure to follow us on Instagram for exclusive health tips and extra content. Have your vision checked regularly. Poor vision can contribute to falls. Make your home safer. Remove tripping hazards, improve lighting, and install handrails where needed. Stand up slowly. This gives your body time to adjust to the change in position. Stay hydrated. Dehydration can cause dizziness and increase the risk of falls. Be careful with alcohol. It can interact with medications and increase dizziness. Review your medications regularly with your doctor. As you age or your health changes, you might need to adjust your medications. It's also worth noting that the risk of balance problems from medications often increases with age. This is partly because older adults are more likely to be taking multiple medications, which can interact in complex ways. But it's also because our bodies process drugs differently as we age. As we get older, our kidneys and liver might not clear drugs from our system as efficiently. This can lead to higher levels of the drug in the body, increasing the risk of side effects. Our brains also become more sensitive to certain medications as we age. This is why it's especially important for older adults to be aware of the potential balance effects of their medications. If you're caring for an older relative, make sure their doctor regularly reviews all their medications, including over-the-counter drugs and supplements. Many of us just swallow our pills without really understanding what they do or what side effects they might have. This isn't entirely our fault. Drug information sheets are often long and filled with medical jargon, and in a short doctor's visit, there's often not time to go over every potential side effect of every drug. But I think we can do better. As patients, we should be proactive about understanding our medications. Don't be afraid to ask questions. Why am I taking this drug? What are the potential side effects? Are there alternatives? Doctors and pharmacists, for their part, should be more proactive about discussing potential balance effects, especially with older patients or those taking multiple medications. We tend to think of balance as purely a physical thing, controlled by our inner ear and muscles, but it's actually influenced by a complex interplay of sensory input, brain processing, and muscle control. Understanding these connections can help us take a more holistic approach to health. So next time you pick up a prescription, take a moment to read the label and ask questions. If you start feeling dizzy or unsteady, don't just chalk it up to getting older. Talk to your doctor. There might be a simple solution, like adjusting a dose or switching to a different medication. Now, we want to hear from you. Are you taking any of these medications? Are you experiencing any balance issues? Share your experiences, questions, and tips in the comments. If you found this video helpful, please type yes in the comments below. Also, don't forget to like, subscribe to the channel, and turn on notifications so you won't miss our next videos. Share with your friends and family so everyone can be aware of these medications that can cause loss of balance. And before you go, check out these 2 videos we selected especially for you. I think you'll love them. Have an awesome day and keep healthy. Bye.